In Galatians 4, verse 6, it says, because you are his sons, God sent the Spirit of his Son into our hearts. The Spirit who calls out, Abba, Father. As you lunge forward with confidence and rotate your trunk with purpose, remember that God has given you the Spirit of his Son, empowering you to move forward through faith in Jesus Christ. Just as a lunge requires balance and coordination, our walk with God requires trust and surrender. So step out in faith, knowing that the Holy Spirit is guiding and empowering you to navigate life's challenges. I'm Roman Hunter. Welcome. Today we're going to be talking about forward lunge with horizontal trunk rotation. So that's forward lunge with horizontal trunk rotation. All right, there are many different varieties or variations to this exercise. I'm just going to show you one of them, and I may touch on some others as well as we go through. Now, this exercise is really good to help with core stability. It's a dynamic stabilization type exercise that also works the legs. It's a quad dominant exercise, core dominant exercise as well because of the horizontal trunk rotation component to it as you step forward into a lunge position, all right? So there is that level of instability and coordination, control, muscle control, and that level of instability that really challenges you to stabilize and maintain good position and posture as you go through this exercise. This exercise helps also with athletic performance, overall functionality, functional strength. It also helps with balance, all right? Helps you with balance. So this exercise can be done anywhere. If you have a medicine ball, you can use a medicine ball, you can use a bottle of water, you can use dumbbells, you can use a kettlebell, whatever weighted object that you have, you can grab it and use it for this exercise, okay? Starting position, feet shoulder width apart, like this. Hands out in front with the object, or if you don't have anything, that's fine. And what you're going to do, you're going to step forward in a lunge position. Step forward in a lunge position, make sure that you're in a lunge. As you step forward in a lunge, rotate towards the leading leg. Right, so you're rotating towards the leading leg and then back to the center. As you return back to the center, you step back into the starting position. All right? So you can do different lunges with this as well. You can do a reverse lunge as well if you want. So you can step forward, rotate towards the leading leg, step back, rotate towards the opposite leg. Okay? So stepping forward again, you can do a forward lunge, rotate towards the leading leg, go back into a reverse lunge, rotate towards the other leading leg. Okay? So it's a really dynamic, it's a really wonderful exercise to incorporate into your exercise program if you want to create and give yourself further challenge from doing the typical forward lunge or reverse lunge exercise. You can incorporate the rotatory or the rotation type component into your lunge exercise. Again, hands out in front. You can clasp your hands if you're not holding anything. As you step forward, rotate towards the leading leg and then back. Step forward and then back. So you can do one leg at a time according to sets, reps. You can do it according to time. You can time yourself 30 seconds, 1 minute. Notice I do a butt kick first. So you do a butt kick and then step out. All right? So again, a butt kick. So when you're doing a typical lunge, some people swing the leg forward like that. So you swing your leg forward like that and go into the lunge. But the problem with that technique is it increases and irritates the knee. It creates an anterior shearing force on the knee, especially if you have patellar tendonitis, if you have a tendonitis or a tendinopathy of some sort. Swinging your leg forward like that and stopping it as you're stepping into the lunge creates an anterior shearing force of the tibia on the femur. Okay? And it produces additional pain and stress on the knee joint as well as on the patellar tendon. If you have congemination patella as well, it can also help in terms of or cause further irritation and exacerbation of painful symptoms in the knee area. All right? So I would strongly suggest that you do a butt kick. So you do a butt kick first and then step out. So you do a heel. So you're landing on the heel, butt kick, heel, and you go down into a lunge, all right? So again, going back into the forward lunge with horizontal rotation, trunk rotation, butt kick. As I go down into the lunge, I rotate to the leading leg, towards the leading leg. So I cross the leading leg side and then back. Show you from this angle. Butt kick, step out, or rotate over the leading leg, all right? Towards the side of the leading leg and then back. Butt kick, step out, rotate towards the leading leg and then back. You can alternate and then back. Butt kick, step out, rotate towards the leading leg and then back. Throughout that movement, try and keep your core braced. Brace the core, keep it nice and tight so you have that nice control, and it helps also to stabilize the spine during movement, which is what is important when we're performing other activities. So this is a wonderful activity, especially if you're an athlete, that involves a lot of rotatory type movement. And even if it doesn't, it's still a wonderful exercise for all athletes, right? Regardless of what sport you play. Keep your hand out. It's also good for anybody else. Average population, not just the athletes. It's a wonderful exercise. And again, if you want to the forward and then back, opposite side, all right? So as you step forward, rotate towards the leading leg, and then step back, rotate towards the other side. All right? So whichever leg is at the front, you rotate towards that side. All right? Whichever leg is leading, you rotate towards that side. So this is the forward lunge with horizontal trunk rotation. Remember, you can use any object, weighted object, a plate, a dumbbell. You can use a medicine ball, kettlebell. If you're at home and you don't have any of those equipment, you can use a bottle of water, anything. And anybody can perform this exercise. It's a wonderful exercise to add to your program. Remember to like and subscribe to my YouTube channel. I'm Roman Hunter. Have a wonderful day. Blessings.